Hello, my name is Giselle Ortega, and this is my end of the semester journal for the Rhetorics and Composition 2 class. In this video, I will be covering on the assignments that were given throughout the semester and what we had to do for them, and also other details as well. So at the beginning of the semester, we were given a choice to pick our own topic for the rest of the semester. So we had to pick a social issue that we wanted to conduct research on and collect data as well. So for my topic, I picked the accessibility of healthcare in America. I picked this topic because many Americans have been dealing with this issue for many years now. And there are also Americans that don't have access to any health insurance or health providers because either they don't have enough money to cover the expenses, or because every time they apply to some sort of health insurance, they get denied their application because something that health insurances do is that they have something like a book of a whole list of diseases or any history of diseases that if someone writes down on the application, then they have the right to deny that application. The way that the whole industry works is that the more employees deny applications, the more money that they are paid. And this was stated in a documentary that I watched for there was one of the research papers. This documentary was on Amazon Prime, and this interviewer, he covered many stories from America on people who didn't have health insurance as well, and how people who didn't have health insurance, they had taken things into their own hands and even figured out ways to heal a scar or heal an injury or a wound. They found new ways to prevent diseases and even have to find other ways of medicine as well. So for the beginning of the semester, the first assignment was the proposal, and this assignment was basically explaining to the teacher on why we want to pick this topic, and also on what we plan on doing. As part of the broader fieldwork assignment, we had to do research on our topics. For my broader fieldwork, I had conducted research and I had gathered information on how healthcare accessibility affects Americans. So mainly people who didn't have healthcare, of course, their lives were much harder than those who did have healthcare. However, there were also people who, if, for example, they had cancer and the doctors had recommended some sort of surgery for them to go through in order to remove the tumor, and it also had, let's say, for example, a 99% success rate. If the patient were to have informed their insurance about this surgery, most of the time the insurance would deny the surgery because the disease or tumor would be experimental or would be temporary, and unfortunately in the end the patient would end up dying or passing away. And this was when I had watched the documentary, and this included a wife who had said the whole story on her husband and how he was doing extremely well, and the surgery was going to help his tumor and it was going to help his life expectancy, but their provider had denied this surgery mainly because they had said that this tumor was something temporary and only experimental. But unfortunately, the man did end up passing away. For my local field work, this was more about El Paso, and because El Paso is built on many immigrants coming from Mexico, a lot of people don't have health insurance in El Paso because it is harder for people who aren't American citizens to receive American healthcare. Even then, if they were to receive healthcare, it has its very various amounts of complications. So I had also conducted a research on how many El Pasoans, they don't have health insurance because of how expensive it can be. El Paso, considering on how much the minimum wage is, it isn't exactly as equal to how much we are expected to pay for health insurance. Another example would be how this year I unfortunately got into a very, very dangerous car accident, and when I had very bad injuries, I sustained very bad injuries, and the paramedic, he had asked me if I wanted to go to in an ambulance to a hospital. If I'm being completely honest, I didn't know whether or not to go in the ambulance because the first thing I thought of was the health insurance. And I ended up taking the offer because the pain was extremely, extremely high. And I found out later on that the health insurance didn't cover the ambulance, so that was an additional fee. There were a lot of procedures that had to be done on me, such as x-rays and also a lot of somewhat medication that I was very doubtful in taking, mainly because of the expenses and if the health insurance would cover it. So there's also that as well. So people can't exactly, if the best way to word it is get sick in peace, because they also have to worry on how much they have to spend money and bills and hospital bills and medication. So a lot of people who even have health insurance look for other ways to not get sick, or even find new ways to just make new medicine, home medicine. And another assignment that was also assigned was the community engagement. And this was more on like a voting perspective, on receiving other opinions, outside opinions. This would include as in taking a survey or making a poll for others to answer. On my poll, I had asked a group of people that I knew, mainly if they knew anyone who had issues with their health insurance, or if they think it would be fair that an American would be unable to get medication because they didn't have enough money to buy it. And an open-ended question that I had asked the survey was that if there was a way that the people thought that the government could help with this healthcare issue. And the majority of people had responded in mainly economic wise, because someone had said that instead of using taxes and other things to mainly fund those taxes in health insurance, because people tend to when people pay for taxes, they aren't exactly being given anything in return. It's only if you don't do it right, of course, you get a punishment. But it would be more efficient, especially for people who don't have health insurance, to have some sort of help from taxes. And someone had also had inputted that because of the economic issue, a lot of people aren't exactly tranquil when they're in a hospital. They mainly want to leave because of the money issue. Many bills, many medications sometimes is even being covered by their health insurance or their health providers. So that's a very big issue. And another assignment that was given to us was the option of an OLLI interview, or a volunteering, or an advocacy podcast. I had picked the volunteering. We had to do 5 hours minimum. For the volunteering, I had gone to a senior home, and I helped the elderly. I helped them sort of decorate for the Thanksgiving theme and, for their Thanksgiving lunch that they're having. And a lot of the elderly people, not a lot of them, but the people that I had spoken to, I had gotten close to, they had mentioned to me on how it can be very expensive. Elderly homes are mainly used for those senior citizens who don't have anywhere else to go, or because they were put in those homes, unfortunately. So, and those homes, they aren't cheap, unfortunately. They tend to be very, very highly priced, and especially to have a very home of commodity, it's very extremely pricey. So, at this point, a lot of Americans, they work and they work and they overwork their whole life in order to not only pay off for their health insurance and other bills, but also be able to pay off living in an elderly home. Many of the senior citizens had explained to me on how the biggest issue was on covering the healthcare that they had been paying off. Healthcare tends to be extremely, extremely, extremely overpriced, not only because of covering a whole family, but also of getting medication and other treatments as well. And the biggest theme or idea that I have gotten out of this whole research and the whole topic was on why having healthcare is so important and having healthcare so accessible to American citizens. Healthcare is it's supposed to lower the price of something that is originally very high priced, but it unfortunately does the complete opposite. Not only would you have to pay extra for health insurance, but mostly have to pay for the other part as well, as in a medication could be $10, $25, but the health insurance makes it $10, but you would have to pay for the medication and also pay for the health insurance, so it would be a lot of extra bills and expenses. Especially giving healthcare accessibility so much easier to people who need it the most. There are people and their families who are working 2-3 jobs at the same time in order to buy medicine for a sick family member, or even have to somehow find a way in order to take care of that family member because they don't have enough money to pay off the health insurance or buy their medication, or in order to get them a hospital bed, because staying overnight in a hospital is very, very expensive. There's even cases like me. Fortunately, I don't come from a very low income family, but I am very middle class family. I couldn't exactly go to a hospital in peace without having to worry about the extra expenses. Luckily, there wasn't anything too big, so of course there was that. But people can't exactly get injured in peace, if that's the best way to explain it, because instead of worrying of their injuries or their diseases or buying off medication and everything, they're also worried about that, but they're mainly worried on the expenses and the bills that they have to cover. And making healthcare more accessible to Americans, it would certainly lower the death rates in America, whether it's because of unnatural causes or natural causes. It would lower it a lot more. And that is the end of my end of semester journal. Thank you.